You can go ahead and run your presentation. Sorry.
All right, thanks. Thanks, Don Gamelis and Argos and everyone else for organizing this event. Very timely. Those of us down here who've had a good dose of toxic air pollution from the wildfires are learning firsthand what a prevalent part of our existence it's going to be with climate change and continued reliance on fossil fuels and potential industrial accidents. What I want to do tonight is give you a very high-level overview of the Aliso Canyon Disaster Health Research Study, and then touch on a few results. Don asked me to present this as sort of a model of the kinds of health assessments and exposure assessments you can do after you've had an industrial disaster or a natural disaster. I guess we might call it unnatural disaster now with wildfires because humans are playing such a large role. Just for those who maybe aren't familiar with this event, it happened in 2015, 2016, was the largest single leak of methane ever recorded in US history. The facility is an underground oil field that was depleted. It's actually the John Paul Getty's first oil field. And it has a huge storage capacity. So it's no longer viable for harvesting oil, but it allows for the storage of an enormous amount of natural gas. And there was an uncontrolled fugitive leak because the pipe, which goes to about 8,500 feet underground into the cavern, ruptured at around 1,800 feet, and they were unable to control it. So really, I put 9,000 people evacuated, but I think it's 9,000 households, so it's more like 25,000. And the methane was released. It was the equivalent of all the cars driving in California for a year, roughly, in terms of its contribution to climate change, so greenhouse gas emissions. But I and other scientists that were working in the field, including Don Gamelis and Argos, began to measure air pollutants like benzene, toluene, ethylbenzene, xylene, some particles, and doing indoor sampling. We assisted the LA County Department of Public Health. And we definitely were detecting elevated levels. They weren't always above health standards, but many times greater than what we would normally find in Los Angeles air in the immediate community surrounding the facility, and going as far out as really about 7 or 8 miles. We also found in the homes an unusual cluster of metals, barium, antimony, strontium, manganese. And it really, for us, indicated that there had been large-scale penetration into the homes from this leak. And what was happening is people were going back to their homes without properly remediating the indoor air pollution that had settled there and getting quite sick as a result. We also saw numerous times where there were oily substances that were blowing out of the facility as well, and these deposited on outdoor surfaces like cars, picnic tables, that sort of thing. So, when we step back, I think it's fair to say that urban disasters are becoming much more common with the climate crisis and with our continued reliance on fossil fuels as our main energy source. And it's really important to understand the long-term health implications of these disasters and really of continued reliance on using fossil fuels. And this is a large study, $21 million. It's funded by part of a lawsuit from the state of California against Southern California Gas and Sempra Energy that mandated the execution of a health study, an exposure study. But I think, importantly for your purposes up in the Bay Area, this can be used as a means of modeling how you deal with other disasters like refinery leaks, for example, wildfires. So our broader research questions were whether or not exposures from the Saliso Canyon disaster affected people's health adversely in the past or in the present. Whether the ongoing emissions from the facility are adversely affecting people's health, and whether we can link health outcomes to specific exposures from the facility. When we look at the environmental exposures, we're really trying to assess, and thanks Eric for that nice lead in, the composition and the amount of emissions released. And we want to examine how the emissions travel through the air. And importantly, we want to know where they landed and who may have been exposed. So we've got several sub-studies for the exposure assessment. We're using, and I'll show you this in a minute, remote sensing satellite imagery to try and get a more precise understanding of the impact zone from this study. And we're building that into and working with Dr. Mike Kleeman at UC Davis to develop what's known as a chemical transport model of methane and air toxins, so we can characterize the exposures that occurred during the disaster event, but also for routine operations of the facility. We also have analysis of raw natural gas that's going into people's houses to see whether we can better understand the composition of the gas. Remarkably, this compositional analysis is not something that the gas company is required to report. So we really need to know what's in the gas so that we can do a better job monitoring that. We're in our final stage of conducting indoor and outdoor air monitoring for speciated particles, meaning that we're looking at the chemical and composition of the particles, and for volatile organic compounds. And Dr. Tom McCone at UC Berkeley is leading a quantitative risk assessment that looks at all cancer and non-cancer outcomes and how those could be related to exposures from the facility and whether or not it's elevating people's risks. We have a wide array of health studies that are ongoing, and I'll just break these into existing data and newly collected data. So our first emphasis has been on children's health, looking at adverse pregnancy and birth outcomes like low birth weight babies, preterm birth. But we're also ordering and just waiting for the state to deliver neonatal blood spots. So every baby born in California gets a heel stick taken from their heel that then, sorry, I don't know what's going on with my computer. And then that is stored. So we can do very complex analyses on that with what's known as metabolomics. So we work with Dean Jones's lab at Emory University, and they can literally pull 10,000 different molecules out of one of these little spots of blood. So we can look at abnormalities before, during, and after the blowout event, which is really important to be able to look at these things as they occur temporally and spatially. We're doing analyses on cancer registry data, on healthcare utilization, and we're also using the California Health Interview Survey data to assess whether or not the blowout was related to a wide array of health outcomes. And then we're doing new collections of data. So we have a survey that is being done on 2,400 people, about 1,800 in the affected area and 600 for control locations, and I'll talk a little bit more about that. And then we're doing a sub-study on 600 people, which will include a clinical exam that's being led by Dr. Wendy Robbins of our nursing school, and a biomarker study. So we'll be extracting or sampling blood and urine from the participants and having them do lung function tests. So one of the big questions is, who was impacted by this event and who is experiencing ongoing exposures during, before, during, and after. And here, we want to be as specific as we can to characterize that impact zone, but we also have to concern ourselves with sample size. So if we don't have enough people in the impact zone, we can't really conduct quantitative spatial epidemiology. So there's a bit of a tension there. But smaller areas could lead to very small sample sizes and data that's too small to discern differences between the affected area and other comparison communities. So to characterize this, we're using those methods I mentioned, the satellite imagery, chemical transport modeling, reports of health concerns from residents, and our initial analyses on birth outcomes. This just shows 4 different satellite retrievals that are available. And this is really, an important source of information. It has its limitations because all we can see from space is the total column. In this case, we're looking at methane as a sort of sentinel marker of the potential toxics. But it does give us an idea about how far away the impacts were stretching. And on this day, it was about 8 kilometers. We do see influences going out to 18 kilometers, but it is somewhat concentrated in that first 10 kilometers. And then we would take, the health data and in that area and demographically match it to control areas. So based on these demographic, socioeconomic, environmental, and health conditions. And here we have 2 sets of controls where we're recruiting that survey data and all the people that go in the clinical exam. Here's our impact zone. These are just the zip codes. And we found very good matches not far away in the Simi Valley. This looks like it's right beside the impact zone, but there's a mountain range between it. So it is insulated. We don't see any impact from the blowout on these communities, but they are demographically and environmentally very similar otherwise. And then we have a much broader selection of control areas that we can use for administrative data like the cancer registry and the administrative healthcare utilization data that's available everywhere and is relatively less expensive to work with. I just want to give you a quick look at what this means when we start getting into the epidemiology. And this was where they're looking at women exposed to the disaster in the impact zone have more adverse birth outcomes than expected. And this has really been a major advent in spatial epidemiology, is this idea of quasi-experimental design. So just like if we were trying to test the efficacy of a drug where we would give some people the drug itself and other people would receive a placebo pill and they wouldn't know, what we try to do is to always have a control group that is demographically matched, that's outside of the impact zone, so we can make certain assumptions about what we might see in their health patterns in the absence of the disaster. So here we're able to characterize the birth outcomes, before, during, and after the blowout. And we use a statistical method known as difference in difference modeling. I'll show you more about that. We looked at low birth weight and preterm birth based on California's birth records. So this is just how these quasi-experimental designs work. So we may have a period before the disaster. There could be some places that have higher prevalence of adverse birth outcomes for a variety of reasons, but they generally track in what are known as parallel trends. And this is the outcome that we would observe following the blowout in control areas. And here's what we might expect if there was no impact of the disaster. But what we're hypothesizing is, as we move through this, that we're going to see these outcomes become elevated roughly during the period of the disaster and in the impact zone. And then it would come down and closely match what it would have been otherwise without the disaster. So this is our estimated effect from the disaster. And because we're simulating what would have happened in the absence of that disaster, if we see deviations that are large, we can detect those statistically. So for this, we characterize different periods of the woman's pregnancy. So third, second, and first trimester, and you can see just here where they overlapped with the disaster. We end up with quite a large sample, something like 30,000 women that within the impact zone had babies in that period. And then this red line is our control communities. And what we can see here, you can see that little dashed line is what we would have expected, but we see this big spike in low birth weight babies. So it was more than 50% higher than what we would expect, and significantly different than what we would have expected without the disaster. And this is relative to all of LA County, but we tried it with many different control groups, and that really persists. And what we also see is that as we go farther away from the site, the odds of having low birth weight babies go down. So beyond 15 kilometers, we don't see anything. At 10 to 15, we see this slight elevation, and by the time we're within 5 kilometers, about 3.5 miles of the facility, we get this more than 60% increase. So it shows us that there's something going on that's likely related to the facility, because we have this graded, what epidemiologists call dose response function. So I think this study could serve as a model for understanding exposures and health impacts of a major industrial disaster or other disasters like wildfires. And it can be used to examine, a wide array of different health outcomes. And we're currently extending this to better understand the impacts of the wildfires in LA. And this is a really good article that was written by a smart New York Times reporter, Nathaniel Rich, on the disaster for anybody that's interested. And just want to thank you for your time this evening and thank all my collaborators. And I'm happy to take any questions you might have.